Hello, dear aquarist. Today you join me for my video 122, where we talk about a common fish in our hobby, which is the molly. Here we talk about a silver molly, which had a bacterial infection. Well, you will say, well, Gerald, there you are again with a bacterial infection. Why it's always so many times bacterial infections? Well, to be honest, it's a very common problem because we keep fish in tropical conditions. We are polluting the water with nutrients, with food, with excrements of the fish, which is all favorable to have bacterial infections going on in our aquaria. And that's we have to deal with. In this case, you see the molly having those red bleeding parts in the body, on the skin. Well, this is usually caused by bacterial infections. Sometimes it's parasites, but then a scraping can tell you if you find parasites. And here you see the scraping and the scales. You see the bleeding part here, and you see the darkening colonies of bacterial growth here. And then you also see on the scraping those thousands of bacteria as little sticks or little spots on the skin scraping. Here it's at 400 magnification. You see a lot of bacteria, which was of course having a problem causing on the skin. We also found some holes. We call that scale holes or skin holes, which is Dr. Jung's described a couple of years ago, caused by an amoeba, making these holes here in the scales, and the fish will lose some scales, and that's where you find some scales on the bottom of your aquarium. Well, difficult when you have gravel, but in a glass tank you can see the scales are laying, and this is causing lesions and a poor condition of the fish. Also, the lamella here had a lot of gill rot in the gills. The lamella were gone. Look how bad those gills look like, decayed. Here more of the gills in poor condition. More in poor condition, see, fused, losing its function as a good gill to do the respiration. Then we gonna examine the organs internally. We found that the liver was in bad condition. See the darkening areas in the liver. You see the necrotic parts here at the spleen. See the necrosis coming up. And why it's necrosis? Because we found a lot of bacteria here, that what the video shows. So we had external bacteria, we had internal bacteria, we had bacteria in the gills. So the fish was full of bacteria. You see the little stabs here, the sticks of bacteria, the spots, maybe 3-4 different kinds of bacteria. Well, what can you do? Well, you know it's a major problem, it's a bacterial infection, and you should really try a good antibacterial treatment. And in this case, so far gone, it's better to recommend a good antibiotic and ask your fish doctor who is acquainted with the application of certain antibiotics in this case. Also, a treatment with formalin, malachite green, and methylene blue or FMC helps to control the amoeba, which causes the holes in the scales. It's described in my latest book on fish diseases, the new illustrated, the new guide of practical guide. There I describe this kind of holes in the scales infection. And many fish can be helped if you start feeding as soon as possible with a functional fish food, like our Dr. BASSLEER BIOFISH FOOD FUCO, or grapefruit seed extract with MORINGA, or the professional treat, and treat at least for 30 days. Do not feed any frozen or live food because during those 30 days, because they might be polluted with bacteria and might cause more even serious problems. So those are risks you can take or you should avoid with your fish. Read more in my books, available in different languages, available at my website, or try to become a patron at my Patreon to learn more about my courses on fish diseases. So I hope my explanation of this diseased molly helped you to understand that bacterial infections can be a serious problem, and you should act properly and adequately with a good treatment, usually an antibiotic. Thank you for